Hi, my name is Henry Vernov. I'm a product manager for healthcare vertical at Citrix.
Hi, I'm Michelle Leafleur. I am the Vice President for Health Information Technology Services and the CIO here at Hamilton Health Sciences.
In general, whenever looking at the solution, tools available, and something that your teams might be developing, do you approach technology as a tool or as a solution to a particular problem or a challenge?
I'm going to answer that both ways. I think it's both, depending on what the issue is. We try, our teams here try to be working with the operational stakeholders to understand what the need is versus what's the solution. Let's really understand what the need is, what our desired outcomes are, and then enable the right technology to support that need. So our approach is not to say, hey, we have a technology here and it would be great for X. It's what are the needs of the organization? What's our strategy? What are we focused on? What are the corporate priorities? And how do we get there? Now, having said that, there are other things from a pure technology perspective. For example, in the cyber world, we're going to be, as we learn and the technology evolves, we'll be educating ourselves to say, okay, that piece that we need, whether it's some new AI enablement or something that we need to put that into our place. So it's both dependent on the scenario. But for our work with our clinical stakeholders and our business stakeholders, partner at the table to really first understand what we want to accomplish versus jumping to a solution first, which can put you in a lane that might not have your eyes wide open.
Yeah, that's a good fit. It puts a foundational kind of structure around it, right? Versus getting to the point where tons of solutions, tons of tools are available, kind of redundant tools, which brings a whole complete different set of complexities and inefficiencies to the organization. So I agree with that. So having a lot of work, lots of opportunities and challenges that you need to face. What are current initiatives that your team is currently working on at this time?
So from a corporate perspective, we have a strategic plan in place, and all with the desire to support our vision of best care for all in Hamilton Health Science. So we have a strategic plan for this year that really looks at things in three lanes. This is not technology strategic plan, although technology enables many of the pieces. So in terms of our patients, people, research, innovation, learning, and sustainability for this year, some of the big things for Hamilton Health Science are in what we call our in-year objective bucket. So those are things that are more tactical metrics or KPIs that we really want to change the outcomes for our patients and our providers. There's a lot of work continuing here, like other organizations, around sepsis. And sepsis is something with our EHR that we are able to provide a lot more intelligent decision support and monitoring, so tightly tied into those initiatives. We are live on an EHR now. So how do we improve barcode medication administration? That's an in-year objective for the organization, not for IT, to get our rates up to 95%. We're almost there, to make sure that we're getting the safety and value out of that big investment. We have what we call corporate projects at Hamilton Health Science, which are not what I would call necessarily transformational, but just big projects that as an organization, we all know that we are moving towards. So very important in our organization to have things clearly identified so we know what the priorities are of the organization. Without that, everybody has their own priorities. And then that makes it very difficult from an IT perspective because everybody's looking for something, but they may not align to what the corporate strategies are. In that area, we're doing a lot of work in our ambulatory care space in terms of optimizing it, creating efficiencies for our patients and our providers. Patient flow and access continues to be a challenge in Canadian healthcare. We talk to our American colleagues and they go, how can you be at 120% occupancy? We are. And so things around flow are in our continued project that we try to work through, that the operations are working through, and we're at the table with them now, being much more of a partner to be discussing what are opportunities that we could help them with. A lot of things around people plan, as I said, and we have those shortages. So our people and culture department is really looking at different ways to create new models of care. How do we leverage people in different skill sets? How do we maximize their skill set? How can technology play a role there? A key one for us in those corporate projects, from my team's perspective, is are delivering a new digital health strategic plan. So we had a strategic plan, a 5-year plan, digital health plan, which really culminated after many things, including our EHR implementation. But so we're renewing that right now. And for the last 5 months or so, we've been working across the organization and regionally and with government partners to understand what we need to do from a digital strategy to support objectives. And then transformationally, our organization is always looking at things. We have new buildings opening. So what do we do to enable those? We have a lot of work going on in our equity, diversity, and inclusion mandate and strategy. It's a key objective for our organization, like it is in most places. And some amazing work is being done in there by the team. And each of these, as you see, they touch technology. So even with our EDI team, there is a lot that we are working on with them in terms of our EHR to really be able to capture data that we can then say, how are we changing the outcomes? If we see that there's an outcome differential in any of our in any of the diverse groups that we serve, because we have a very diverse population that we serve here. And amazing things going on in terms of a new research strategy that also requires a lot of digital enablement. So I'm smiling because our group is really involved in, IT is no longer in healthcare anyhow, an IT shop that is doing servers and widgets. Those are important. Don't get me wrong. But we're really partners at the table for how to enable and support organizations through big strategies. So that's our current strategic plan. We have a new CEO who joined. She joined not too long ago. So we are actually rebooting a brand new corporate strategic planning exercise as well. So that's super exciting. But those are the big things. And then there's so much that's going on day to day that I think everybody forgets all the time, the day-to-day work for all roles across the organization. But some really exciting project and transformational stuff that's going on that requires technology, sound technology to support it in the right direction.
It sounds really exciting to come to an organization with such a wide array of opportunities to work on and to achieve something meaningful for patients in your organization. But at the same time, with so many initiatives and challenges, what does it take to keep the organization, different groups aligned? While everybody has the same goal, they might have different approaches. So what does it take to manage and run organization and keep the eyes on the ball?
Oh, Henry, if you had the answer for me on that one, it would be fantastic. Through all well intentions, there's a lot in the corporate priorities and strategies that I just talked about. But day to day, our ORs need things and other things. So there is a lot of, from a digital perspective, requests. So, I haven't yet found an easy way to deal with it. A lot of it's relationship management and conversations, but we have put a fairly extensive amount of time in the last year around governance, and not only governance in terms of helping with staying aligned to priorities, but governance that is not IT driving IT, but operational ownership, transparency with our organization around capacity, around requests, around where people's requests exist. People can sometimes get frustrated that IT might be the house of no. We are very much focused on changing that we're a partner. And if the answer is no, we'd rather the answer is no than not know at all. So, but having said that, it's not easy. We have to be agile and nimble. We got to try to keep capacity in our teams that are already short to be able to pivot to things that weren't expected or become the new priority of the day or what have. So trying to use governance. We're trying to use a very rigorous intake process with a lot of transparency so people know that if something needs to pivot, it's a decision that's not made by IT. It's a decision made by the organization. So it's a good problem to have. Lots of things that need to be done that now require really great digital health thinkers around the table. Yet at the end of the day, there is finite capacity. Are you seeing that elsewhere? Does anybody have the magic solution out there for how to deal with competing priorities?
Definitely not. If I definitely don't have an answer, but from my perspective, again, I have a very interesting seat being able to talk with other customers or multiple customers, and everybody has different approaches to address the same problems, right? So again, being able to say no in some ways is one way to take on a new task, new opportunity, to achieve something that's meaningful to them. Some people have to make a hard decision and cut down on some maybe point solutions that they're leveraging, or very maybe ineffective solutions that they put in place, because whenever they were going through validation process, they think that something would provide them a specific result, a quantifiable result, but some path down the road that uh, might not have met their expectations, so they'll need to pivot. And the earlier they pivot, the better the decision for them. They can take on the new opportunity or a new task at hand. So you also, Michelle, you mentioned, having working with technology partners, having solutions that address certain kind of broader issues, and in IT not being kind of in a no answer mode. So in your experience, what value have you been able to derive from partnering with Citrix and leveraging Citrix technology within your organization?
Well, lots of different things, to be honest. One thing that we've been trying to do, not just with Citrix, but all of our strategic partners, is continue to have conversations with our strategic partners. Citrix we have a very complicated environment with very disparate campuses and a number of things that we need to create a great user experience, a seamless user experience in terms of how they're interacting with different things. And Citrix most certainly has been our key partner in how we are delivering workflows out to our clinicians, our finance people. On strategic partnerships, Citrix has been at the table with us when we've had issues, when we are talking about strategy, both so that Citrix understands where we want to go and what we need to do, in addition to where Citrix is going. And we're doing that not just with Citrix, but with all of our key vendors. What are the finite key vendors that we have? Well, we have lots of vendors, but some are niche or smaller vendors. And then we have our big EHR vendor. We have Citrix. We have Microsoft. We have a lane of large strategy partners that we want to be tightly connected to, so that it is a partnership versus we have an issue relationship. So certainly for Citrix, in terms of how, as I said, user experience and interactions for our complex world has been one of the keys for sure.
As you work with strategic partners, how do you provide for certain functionality that you're looking to achieve, or within your organization with certain workflows, some capabilities may not be available? How do you work with partners to capture the feedback, capture the needs, and then be on the journey to enable certain functionality that's critical to your success?
It's a great question, Henry. Like, we don't want to be in a space, at least here at HHS, where just if the 10% is not done by one of our big strategic partners, that we go get another partner, because we're trying to, in many ways, consolidate on strategic assets. There's lanes for things, don't get me wrong. I've been around for a long time, so I'm not naive, but we first ensure that our internal stakeholders, be they clinical or business, understand that these are the large assets, the assets that we work with. We are going to entertain with those partners how to maximize them as much as possible before we introduce another technology into our space. That might mean the 10% isn't accomplished. If the risk is manageable, then that is okay. But for folks, for example, like Citrix or Microsoft or Epic or any others that we want, it is a bidirectional. It's a partnership. Marriage in many ways, long-term marriage, these things are expensive, so you want to stay married. But it is a partnership, not only for us to understand where your roadmaps are, but for you to understand where our roadmaps are, and to have really open conversation around where there are gaps. The best partnerships let you talk about the challenges around gaps, and then see if there is a path forward. Sometimes there might not be, and you might need to fill that niche. Other times it might be already on somebody's roadmap, and we just need to understand when and how do we get there. But in the end, I think a lot of that just really is coming from really great partnership relationships, us to our partners and our partners to us. And so we're very, very focused on that to see if we can eliminate redundancies and gaps as much as possible. Particularly in our fiscally constrained environment, introducing vendors upon vendors upon vendors to do niche lanes, the return on that investment needs to be enough to cover it. The value on something net new needs to be significant enough. And it's important for us, if our strategic partners have a gap, that they understand what it is and will they work with us on it. So, open relationship. Are other people sort of the same approach with Citrix or others, just really making sure we're tightly tied to conversations about directions?
No, I mean, in the last couple of weeks, for example, I participated in a couple of EBC's meetings with customers, and kind of you as you speak with them, you kind of start seeing right away who you are working as a customer and who is real partner. And there's the more you have interactions with customers, the more you have an open discussion, whether on a roadmap, you share the issues or challenges you're facing as a vendor, and kind of being transparent. Yes, you can share some NDA stuff, that's fair, but in terms of speaking general on what challenges you're seeing, what opportunities you're seeing, and kind of having open lanes of communication, that I find that as a key to having or in developing these strategic partnerships. And from my experience, if I go a couple of years back, it might have been a challenging at times get certain feedback, get certain meeting, get certain response. But as you show up to the meeting or to an event to provide them an honest answer, an honest feedback, bring additional resources to the conversation, which I might personally not be able to speak to, that opens up additional doors, mutual trust, respect. And once those things are available, I feel a lot of challenges can be overcome, whether they are small or large. So again, joint respect and understanding and openness would be key to success.